Hello, my name is Sarah Phillips and I'm doing my practice physical assessment. This is my friend Jessie. She's at Northeast State with me and she's allowing me to do the physical assessment. I'm acting like I'm coming in as a home health nurse and just going to do my practice assessment. This is Roxy, by the way, if she decides to jump in the video. Okay, I'm going to start out and just go ahead and do the physical assessment. I'm going to get Jessie to sit where we can see her. Okay, Jessie, do you know what year it is?
It is 2017.
Who's president?
President Trump.
And where are we currently?
We are at my house.
Okay, the patient is alert and oriented ×3. I'm going to start out and do, start at the head, and I'm going to start going through her hair. It's very clean. I'm looking for hygiene. I'm looking for placement. I'm also making sure that everything is dispersed well and everything is good. I'm not noticing any lumps or bumps on her head or any lesions. I've already been assessing her skin, which is clean and clear, and I don't see any bruising or scratches or anything of that sort. If I did, she does have a mole on her back that I would assess later. I would go ahead and look at her face and get her permission. Is it okay if I touch your face?
Yes.
Okay. Everything looks good. I'm noticing her sinuses. Nothing seems inflamed. Are you having any tenderness?
No.
Okay. Can you look over here for me, right at my ear? And I would have a light and I would check. But she doesn't have any issues with accommodation, and she has perla, which means her pupils react to light. Can you breathe in for me? Breathe in. Both of her nostrils are patent. I'm going to ask you to open your mouth for me. I'm checking her mucous membranes and everything is pink and clear. Her tongue is the proper color. Do you have any issues with swallowing or anything? Mm-hmm. Okay, no pain. So I'm going to go ahead and I'm checking again. I'm going to ask you to swallow for me. Her trachea is palpable to both sides. I'm going to go ahead and while I just have her sitting here, I'm going to look over her arms. Her skin is warm and dry to touch. Her capillary refill is under 3 seconds. I'm going to go ahead and do some of her musculoskeletal while I have her arm. Can you push against my hand? Good. Now push down. She's very strong. She got them muscles. Okay, and I'm also noting her pulse. I can feel it. I would grade it as 2+, and it goes all the way down to her wrist, so I know that she has good filtration. I'm going to go ahead and listen to her back. I'm going to get right behind her. Can you take a deep breath for me? Again. Again. And again. Good. Her lungs sound good. Not having any allergy problems. Okay. I'm going to check her chest expansion if you'll take a breath for me. Another one. Okay. Her breaths are good bilaterally. I'm going to go ahead and listen to your heart a little bit. Okay, I can clearly hear her heart, and I don't hear any murmurs of any sort. I would usually take an apical pulse, but however, I forgot my watch, so there's that. I would also at this point take her blood pressure, which I forgot that as well. If you wouldn't mind laying back for me, I'm going to check your apical a little bit. If you wouldn't mind just leaning back on the pillows. What I'm going to do is I'm going to do it over the shirt though, just because for privacy matters. This is right below where the bra would be, about right here. Okay. I could hear it accurately, and I would usually check this for a full minute. This is very important for anytime you're taking serious medications or before. You would also make sure you would write this out. And also, sometimes you would want to check the difference between the apical pulse and the pulse you would get with either radial or a carotid. Okay. Next, I'm going to do your legs. If you'll push against my hand, good. Push with my hand, good. I'm checking her pedial pulses right now, which I can feel. Okay. I'm also not noting any lesions on her legs. There's no hair, but she is shaved. And I'm not noticing anything that is major issues. Her musculoskeletal is good. If you wouldn't mind standing up for me real fast. Yeah. Okay. And I'm just going to make sure, can you balance on one leg for me? Good. Now the other. Good. Do you have any issues walking or with balance or anything?
No.
Okay, I'm going to ask you to close your eyes for a second, and I'm going to put my hands up in front of her, and we're just checking to make sure. Okay, you can open your eyes. She doesn't have any issues with balancing. You can go ahead and sit down. Overall, I'm not noting anything too extraordinary. So at this point, I would ask if she has any tenderness before I palpate her abdomen. You'll lay down for me, or whatever. I'm going to do this over the shirt just for privacy reasons. Okay? And you just want to, usually you would inspect, seen her belly before, it's all good. Then you would want to listen to it before you palpate because you don't want to move anything around. So I'm going to listen to each quadrant. Get that in my ear. Okay. And I didn't hear over hyperactive sounds even though we just ate Chick-fil-A, so that's good. I'm going to lightly palpate her stomach. Please let me know if you have any tenderness.
Okay.
And I'm not noting anything that's pressing out against my hand. There's no tightness that I'm looking for. There's also no signs of inflammation. Now I'm going to percuss a little bit just because I like to percuss. And I didn't hear anything that would sign for any abnormalities. And at this point, that's all I would ask for her, and I would note everything as I've said out loud, making sure to note anything that the patient says is abnormal. Thank you.